Community Medical Clinic at 270-365-0227. Your partner in good health.
1580 103.3 WPKY. Good morning. Time is 8:30. It is 45. It's supposed to warm up just a little bit today, so we'll see what happens. We're joined this morning by Dr. Rogers from Rogers Vet Clinic. So this month is, good morning, Dr. Rogers.
Good morning.
Thank you so much for coming in. I appreciate you coming in and visiting with us today. February is Dental Health Month, National Dental Health Month.
Yes, ma'am.
That includes our animals, yes?
Yes.
So talk to me about pet dental health.
Okay. Pet dental health is very important, vital to dogs, cats, and species that we deal with. We deal with all different kinds of species, even talk a little bit about horses also. But other than that, like I said, their health is very valuable, and like I said, taking care of their teeth, as we know, young in life, we don't worry about our teeth too much. They seem to do fine, and then as we start getting older, they start showing problems. So we have, in the dogs specifically, certain breeds of dogs are a little bit more predisposed to dental health problems. But like I said, as part of a regular examination when pets come in and everything, we look at their teeth, we talk to the owners about their dental health there, whether it be February, we're focusing on dental health, or whether it be all year round, we're trying to talk to clients about the health of the pet and their teeth. So when we start seeing plaque formation on the teeth, we'll talk to the owners about, when's a good time to start doing a dental or start doing something to prevent any future problems from moving fast. We know we get older every day. Our pets average 7 years for every year of our life. So like I said, when you see a pet from year to year, gosh, that's 7 years in our life. So we know how fast our life seems to go. So when we look at these teeth on pets year to year, we'll see a lot of plaque build up, and then the gum starts eroding, and then we start having teeth starting to fall out or get infected, and we have pets not eating good and not feeling good, and sometimes these teeth will abscess and we have to pull them, and we like to get there a whole lot earlier than that for sure, but then a lot of times we do see them when they are at critical stages, when they aren't eating. So like I said, we try to prevent as much as we can by doing regular prophylactic dental scalings and everything, just like people. When was the last time you went to the dentist?
I go every 6 months. I'm good about my own health.
There you go. And I brush my teeth every time after I go to the dentist, but then it seems to slip a little bit. But pets are a little different. We have to be innovative sometimes on how to take care of their teeth, because not every pet's going to stand there and let you do it. Yeah.
See, and that was going to be my question. I can't imagine brushing my cat's teeth.
Yes, that's a good one. And very few brush their cat's teeth. I must say 1% of the cat owners maybe brush their cat's teeth, maybe 2%. But like
what's the percent that brushes their dog's teeth?
5 to 10.
Really?
Yeah.
See, I don't do that either.
Nah.
Okay, so talk to me about alternatives to like taking a toothbrush to my dog's mouth.
Brushing is the best. There's nothing that compares to it. And like I said, brushing a dog's or having a dog's teeth brushed once a week or once a month is the equivalent of us brushing our teeth once a week or once a month, okay? So just imagine that's not going to do a whole lot, okay? So there are other alternatives. There are new products now that you can put in their drinking water, which help slow the formation of plaque on the teeth. But all these are basically slow preventative processes, because the process will still continue. You and I take mouthwash and brush our teeth. It's still a process that's taking place. And plaque is nothing more than the formation of bacteria on top of bacteria on top of bacteria until it can crack off. And so other than that, like I said, the key is if the teeth aren't taken care of, like I said, you can use supplements to put in their water. There are treats called dental treats that you can give them, which will help some. There are certain foods that are formulated for older pets called Heal Science Diet TD. That will actually, the biscuit will actually shear some of the plaque off the teeth when they eat it. There are treats. Orvet is one of the treats very commonly dispensed by us that actually has a mouthwash in it, and so it kills the bacteria for a short period of time. It's a daily treat meant for the pet, so while they're chewing the treat and it's pushing the plaque off the tooth, then the gel is slowly released and helps kill the bacteria in the mouth. So again, it's a battle on bacteria. We know that the mouth is the seat of a lot of bacterial infections and everything. It carries a lot of different types of bacteria. So again, we've got chews. There are hexa chews. There are dental chew sticks. I have to be careful with some of these treats. People love to treat their pets. I mean, which pet is what treat to get our pet this week? Or I've had some people bring in bagfuls of treats that their pets have and get, and they lead to problems sometimes. So I think the key is we got to find a small treat that doesn't upset the tummy of our pet, that will work and work appropriately. It's not that they're going to be 100% effective. We've got to understand that. But other than that, these treats, if they don't cause problems, use them. Try to use them effectively. The brushing is the best again, but like I said, use these treats as much as you can, whether it be the drinking water, the chews, the dental treats. They have to be given regularly. And doing all that and doing the best you can do, you still will have to scale and polish your pet's teeth. Now, I have a few clients that are very good at brushing their dog's teeth. And those that are very, very good don't have to have their teeth scaled and polished. That's just it. It's bottom line. So, putting your pet up on the table, saying, we're going to introduce you to the toothbrush, doing it every day. You got to do it every day. And once the pet gets used to it and gets used to you doing it, you get used to doing it yourself. And developing the technique, we help our clients with techniques on how to do it and everything. And once you do that, that's the best for the pet. And I've had some people, their pets' teeth are crystal clean because they brush them. It just is, it's the best. It's the best. Let's talk about cats just a second. Cats are they're sort of left by themselves. They're easy keepers. Mm-hmm. Yeah, a lot of people just say, put out the cat food, and as long as she's eating and drinking, peeing and pooping and doing all the little things well, they don't seem to have a lot of problems. But their dental disease is just as dramatic, if not more severe sometimes in cats. Cats also harbor several viruses, sometimes the leukemia virus or the FIV virus or FIP or even toxo. It's not a virus, bacteria, but like I said, the key is it's these underlying diseases sometimes promote these pets to have worse dental disease than they normally would. We'll see a lot of cats that, gosh, are 10, 15 years old, and their teeth look just as clean, and the whistles, everything, their mouth looks good and everything. And others, by the time they're 5, 6, 7 years old, are losing all their teeth, and you go, what's going on in the mouth? And a lot of these cats will have underlying disease. And so we try to help the owners take care of the dental disease, if we can get to it before it gets advanced, and then talk about these underlying diseases if they're there and how to treat them accordingly. But those are cats, like I said, are quite different. We do a lot of procedures with dogs and cats as far as we'll remove teeth if they need to be removed. Sometimes it's a little bit more complicated than a tooth that's getting ready to fall out, and we just pull it out, And others have to be sectioned and taken out. Someone like the carnasal tooth, biggest tooth in the dog's head, its main chewing tooth and everything, has 3 roots, and so it's a little bit more complex. It has to be a high-speed drill, just like a dentist would use, and to section this tooth into 3 sections and take it out a root at a time. Those are the ones that sometimes get infected. We have abscesses underneath the eyes of dogs and cats, and sometimes has to be taken out. But like I said, we do a lot of procedures, whether it be dental, scale and polish, removal of teeth. We'll try to preserve these teeth in the mouth as much as possible. We'll sometimes use procedures to try to protect and prevent slow the process of dental disease in pets. But that's probably it in a nutshell on cats and dogs. Horses, commonly brought to us sometimes for dental float, to float their teeth, and really what you're doing is you're filing down the sharp edges on the teeth so that they don't chew their gums, or not their gums, but their folds or their mouths and their tongues. When these teeth, horses grind their food side to side, okay? And so you can actually sort of do your hand like this side to side, and you go, oh my gosh, that area is going to get sharp there, that area is going to get sharp there. And so we have to go in and file these edges off of the teeth, usually starting at 5, 6, 7 years of age, and then every 2 to 3 years after that. So horses have to be done fairly regularly so that they can continue eating and digesting their food well. They don't chew it well, they don't digest it well, they don't digest it well, then they have colics and other problems associated with diet sometimes.
And okay, so many questions going on here, but we'll just address the most recent one that popped into my head. So I guess there must be conflicting views on that, because I've always been told get your horse's teeth floated once a year.
You can. I don't think it has to be done quite as often. Okay, they do need regular attention when they're getting their Coggins tests and vaccinations. It's always good to examine their teeth and look at them, but they don't have to be floated every year. And when you get 2 or 3 veterinarians in a room, I tell them you're going to have 2 or 3 different ideas on how to do things.
Sure.
Yeah.
Sure.
Yeah. So it's not that one is right and one is wrong. It's just the different approach by different people and how they do different things.
Sure.
Yeah. Do the same thing differently. I'm sorry.
Yeah, no, I understand what you're saying.
Yeah.
And I'm good about getting my horse's teeth done.
Right.
I do my horses. I get them. I do them once a year. I get them floated once a year.
There you go.
But I just don't with my dogs and cat. I just don't even think about that. So, and we don't have to go brush our horse's teeth then, right?
I don't know of anyone that brushes their horse's teeth. Okay. There might be someone out there that does it, but no, we don't. But like, there's not.
Trying to picture where you'd buy a toothbrush for that.
The hardware store would be the first place to go. But other than that, like I said, horses, and surprisingly, again, the length of a horse tooth, the way it grows and everything, they're incredible creatures. They don't have as many problems as their other pets. It really is. But sometimes you have to employ some very drastic techniques when you have abscessed teeth, and we do have some specialists that work with horse teeth as far as if there are problems. And it seems like once a year we have to have a certain tooth pulled on a horse. It's way back in the back of his mouth, or send him to someone that can do it. But like I said, they're a little bit, they do a good job considering, gosh, they're foragers. They eat the grass, and we don't care for their teeth, and they seem to do fine. And so, like I said, they're just incredible creatures. Dogs and cats, again, once they reach certain thresholds in age and certain breeds of dogs, it seems like the smaller the breed of dog, the greater the dental problems. Mm-hmm. Yorkies, which are very, very common dogs, people love them. They're just sweetie pies. It seems like their dental disease will start as soon as they're born. It's just incredible. Wow. And so sometimes pulling lots of baby teeth, we do that often, and retain baby teeth. We call them deciduous teeth. And then as a 2 or 3 year old, the plaque is already starting to form very quickly. And these are proper dog foods that they're eating and everything, but it's just that dental disease has genetics involved with it, just like you and I. We might have family members that have better healthy teeth than others if we haven't caused any physical harm to our teeth by certain products that we've taken or putting in our mouth or whatever. But again, we should take care of our teeth. We do. We have a better chance to have them a little longer. I can remember years ago chewing on some popcorn and shattered one of my teeth. It's one of those things. And then I like to chew on pork rinds, and those are the things that are hard on your teeth too. But like I said, take care of our teeth. Our pets need the same thing. I know pets like to chew on rocks. They like to chew on fences. They like to chew on things. And so you watch a dog, he chews. Dog came in this morning. He's chewing on something. And so made him sick. But like I said, the dogs, if they can smell something on it, board, whatever, they're going to chew on something. And so a lot of these teeth actually are worn down from just chewing on items. Yeah.
I have one dog that likes to drag up deer carcasses. I don't know where she finds them, but she drags them into the yard and gnaws on them the whole time. Yeah. Anyway, okay, so I have 3 questions, and then we have to wrap up. But first of all, I want to find out, how often do we have to brush? You said every day. Once a day, 3 times a day like we do ours? What is it?
Once a day is usually a good rule of thumb. Once a day is the best. And so picking that time, usually 5 to 10 minutes after their meal, is the best time, because you're going to remove any of the food particles and everything, and that will last the longest with your pet. If you brush them before your pet eats, than he eats, then you have really defeated yourself as far as doing it.
Right,
Yeah.
right.
Yeah.
I understand that. That's why I don't even brush my teeth till after breakfast.
There you
anyway.
go.
Okay, second question, just a regular toothbrush. What kind of toothbrush do we need to use?
Well, toothbrush, toothpaste for pets. They're specially formulated toothbrushes and toothpaste for pets, so we don't have to rinse their mouth. It's one less step we don't have to involve ourselves with. So they do a whole lot better if you get the right toothpaste and the right toothbrush. It makes it easier for you to do it. And then we'll give you some tips how to do it. Since this is National Dental Month and everything, we promote it and everything. We offer 10% off our dentals this month just for clients who do it. We do a ton. We probably, every day we're doing 1, 2, 3 dentals. And like I said, people do take care of their dog's teeth, and that's good to see. And I have a technician, Tracy, she just loves to do teeth. And when you have someone that loves to do dentals, they do a better job. They just really do. And like I said, it's just a good little thing to have someone that loves to do them. And like I said, we do go through the evaluation process of the age of the pet, trying to make sure if we need to take blood testing, make sure they're healthy for the anesthetic, and then because the pets have to be asleep and have to undergo an anesthetic while we're doing this procedure.
Okay, and so that's the procedure where you remove the plaque and all that. Is that what you're talking about?
That's correct. Right.
How often does that have to be done?
The dental plaque removal, it's going to vary from pet to pet, but most of the time, no more than once a year. We do have some pets have to do it as often as twice a year, but like I said, these pets have advanced periodontal disease, and sometimes they have to do it twice a year, but most of the time it's going to be once a year or longer. It depends on the care the owner gives the pet. And again, some of these pets will never have a dental because they have healthy genetics, they have healthy teeth, they don't damage their teeth, and they live a full lifetime without any dental, which is good. It's great. That's the automatic pilot pet. You just have to food, water, pet him, take care of him.
Right.
Yeah.
I have one dog that never chooses food. So, surely he doesn't have a problem with dental, right? he just literally just swallows it. Before you can even get the next piece out, he swallowed it. But anyway.
Yeah. Well, he's still got teeth. He still has teeth. If he has teeth, he can have dental disease. Yes.
All right. Okay. Well, last question, because we really do need to move our appointment along. If we haven't done this, we have not taken care of our pet's teeth.
Right.
They're 7, 8 years old. Are we too late?
No. You're never too late to do a dental on a pet. The key is a lot of times we are presented with pets that have dental problems. And so, like I said, when we talk to the client and they agree that, yes, we need to do something with his teeth, do it today. And so they'll leave their pet. And so we tell them sometimes, depending on how advanced it is, sometimes there might be some teeth that have to be pulled. And considering they have a full set of teeth, you've got as many as 44 teeth in the dog's mouth. We might take out 5 or 6 sometimes. It seems like a lot, and it's not, but it's still 5 or 6 teeth. Sometimes they're very, very small teeth. They don't amount to a whole lot. But again, some of these dogs that come in with advanced disease in their mouth, we'll remove several teeth. We've removed sometimes as many as 10 or 20. We don't pull the teeth that don't need to be pulled, but when those teeth are rocking back and forth and ready to come out, it's incredible how easy it is just to pull them out. So we hate to, but it's best for the dog's health, because we know that dental disease leads to heart disease and can lead to other diseases, the heart and kidney. And so these are the reasons that we want to try to prevent advanced dental problems so that we can have a healthier dog and have them live longer.
Dr. Rogers, thank you so much for your time.
Thank you.
Important to get your dog's take care of your dog's dental health. I am going to have to start. I'm going to be better.
Just have them evaluated first.
Yeah, okay, I will do that. Thank you so much.
Thank you.
Here's your WPKY Weather Edge Weather Center forecast.
A flood watch is in effect until 6 o'clock tomorrow morning, bringing with it hazardous weather conditions, so be careful.